Good afternoon, all of you. Before we start the session, I request you all to please switch off your mics and cameras. Thank you. Very good afternoon to respected dignitaries, governing body members of RAV, Director RAV, Dr. Vandana Siroha Ma'am, Gurujans. I welcome you all in another intellectual session of Gyan Ganga webinar series. I, Dr. Garima Singh, on behalf of RAV, welcome you all for today's session. On the onset, we would also like to express our heartfelt gratitude and welcome our mentors who has always been there to guide, motivate, and encourage us for the sustenance of this series. Respected Vaidya Shri Deven Trigunaji, President of GB RAV, respected Vaidya Shri Rajesh Koteja Sir, Secretary, Ministry of Ayush, respected Dr. Vandana Siroha Ma'am, Director RAV. Today's guest speaker is Dr.N. Krishnaiah Sir, CRAV Guru in Bal Roga, who has joined us for today 265th episode of this knowledge voyage. Let us begin the session by seeking the blessings of Lord Dhanvantari. Namami Dhanvantari Devam Surar Surarvandit Pad Padmam Loke Jararup Bhayamrityunasham Dhataramisham Vividhoshadinam. Om Dhanvantaraya Namah. Now, I would like to introduce today's expert, Dr.N. Krishnaiah Sir, who is going to throw light on the topic Ayurvedic management of certain genetic disorders. Dr.N. Krishnaiah Sir graduated from Government Ayurvedic College, Hyderabad, under Osmania University and completed his postgraduate studies at Gujarat Ayurveda University, Jamnagar. He began his academic career as a lecturer in the Department of Rachna Sharir at Mithal Punarvasu Ayurvedic College, Mumbai, where he served for 4 years. He later joined SV Ayurvedic College, Tirupati, as assistant professor in Komar Bhratya, eventually serving as professor, postgraduate professor, and vice principal. After retirement, he became an RAV Guru in Bal Roga. He has participated in numerous national and international seminars, translated Kashyap Samhita into Telugu, contributed to RAV publications on Prasuti Stri Rog and Bal Roga, and received the prestigious Vaidyashri Award from SDM Hassan. Now, I would like to invite Sir to proceed with the lecture. Thank you, Sir.
आपको ब्लड टेस्ट दिए थे लास्ट टाइम करने के लिए, आपने किए है क्या वो? ठीक है, करवा लो ना, और मैं आपको फिर से भेज देती हूँ। बाकी पेट साफ होता है रोज?
Respected, may I start, please?
Yes, sir, you may start, sir.
Okay. Respected RAV President Padma Vibhushan Sri Devendra Trigunaji, and respected Padma Sri Rajesh Kotecha ji, Secretary Ayush Ministry, and the Director RAV Vandana Siroha Madam, and respected Gurujan RAV, and respected my dear students. So, sabhi ko namaskar, and I'm happy to present today's topic on Ayurvedic management of certain genetic disorders. So, this subject I am going to give my experience of 5 cases. So there is no much time left for explanation. Just I go through the whatever the PowerPoint presentation is there. Then if time permits, then we can discuss after the presentation, whatever the details are required or needed. So gene mutations and chromosomal aberrations are really very challenging for modern science. And this problems. Of course, nowadays there is some lot of research is being done on the gene mutations and chromosomal disorders. And you may aware that recently there was a scientific report that 21 trisomy, that is Down syndrome, where they could delete the extra chromosome. So thus, it's a very success story from modern science. That is the latest scientific report. And still, then on gene mutations, the genetic engineering methods of various types are going on. So when it comes to Ayurveda, it categorizes these diseases under Adibala Pravarta Vyadhis, which are known as Bija dosha and Bija Avayava doshas, like gene mutations and chromosomal aberrations. So the present study, the presentation is this the 5 cases with the extraordinary successful stories of gene mutations are being shared with you. First of all, I brief first case. I brief because these are very, very rare cases. They maybe even pediatricians or even specialists, they may come across a single case in their lifetime because they are very rare cases. This is Neolaxova syndrome. This is also known as phosphoglycerate dehydrogenase deficiency. It is an enzyme deficiency. It is because of gene mutation. It is a rare autosomal recessive disorder characterized by severe intrauterine growth restriction and multiple congenital malfunctions or stillbirth sometimes. It is a condition characterized by delayed milestones and speech, that is psychomotor retardation and recurrent seizures. So these are cardinal features. So seizures and delayed milestones and speech disorder. So these are some clinical features. It is need not be that whatever the case we take up, all these clinical pictures must be there. But this is the textual the description that a case will have micrognathia, cleft palate, syndactyly, edema, ichthyosis. So ichthyosis means the dry skin. Next, the neurological features are the microcephaly, lissencephaly. Lissencephaly means the brain is not developed and it remains smooth. And macrogyre, hypoplasia of cerebellum, and neural tube defects are seen in this syndrome. Actually, what happens in this case, in this gene mutation, see, the genes are available in the serine biosynthesis pathway. And this serine is essential for cell proliferation. So serine is critical in production of body proteins, enzymes, and muscle tissues. So serine is needed for proper metabolism of fat and fatty acids. So it also helps in production of antibodies. So now that is the brief about the classical description of Neolaxova syndrome. Now the case study so the chief complaints were the global delayed milestones and seizures 6 months back. So this is a case born to consanguineous couple and a bit post-dated delivery, and parents noticed a mild delay in the neck holding and rolling over was not attained even by the 6th month of age. On 7th March, she developed seizures. And for these seizures, the child has been taken to the same hospital where she was delivered and kept on anti-epileptic drugs and thoroughly investigated and examined, where she found to be microcephalus and seizure disorder. So the blood samples was taken for gene test. This is because they doubted it could be a gene mutation. That is the reason why they have taken. And you can see the cardinal features of this syndrome, the microcephalus and seizure disorders. So there after the giving anti-epileptic treatment, the EEG was found to be normal and MRI brain showing mild atrophy of cerebellum. Please note this, the atrophy of cerebellum and microcephaly. After 3 days, this was done, and after 3 days, child has been brought to our hospital because our hospital was very popular for the delayed milestones, especially cerebral palsy. And so, after completion of their the acute stage, the child brought to our hospital, and where they initially we have given only Shamana Chikitsa, Vatahara, and Apashmara Chikitsa. And by the time they visited second time in the month of June, the child was improved because they except the anti-epileptic drugs, the modern people didn't give any medication. But when we started our medicine, the second visit, the child was improved and came with a gene report because it already more than a month was over. So now they came with the gene report and it was discovered as Neolaxova syndrome. This is also known as PHGDH gene. This is phosphoglycerate dehydrogenase deficiency. So this deficiency leads to the serine, it interferes with the serine protein metabolism. Now the past history. The mother had the COVID positive twice during the baby's intrauterine life. Now the child, the time of delivery, it was a normal vaginal delivery, but didn't cry, a bit post-dated, and birth weight was 2.7 kg. And in postnatal period, all delayed milestones with multiple episodes of seizures at 6 months age. And there was found to be the recurrent respiratory problems that was noticed as a allergic rhinitis. So family history. Now coming to the parents couple were consanguineous parents, and there was a history of seizure disorder in the family, and the elder female child was normal. So this is a developmental history. See, almost all the gross motor milestones are delayed. Neck holding 6 months, rolling over 9th month, see, so on. So she started the walking with support only at the age of 13th month. By that time, we have already started our treatment. Bisyllables, she started at the 13th month. And immunization history, they followed national immunization program, and breastfeeding and solid food introduced at the 9th month of age, and there was no pica. This is everything, the general examination. This is what I am saying. It need not be the entire full-blown description of this syndrome need not be present. So here, otherwise, the rest of the things are vital signs and other systems were normal. The in respiratory system, allergic rhinitis was found and the lungs were normal, other system. Only the see her head circumference was 39 centimeters at the age of 1 year. This is a microcephalus case. This is a and provisional diagnosis, say microcephalus with seizure disorder. And after the investigations and the MRI brain, in the MRI brain, there's a cerebellum atrophy and microcephaly and gene test. Here it is found the positive Neolaxova syndrome. So this is for your evidence. This is the original report of the gene test. So she is here, exon 13, and the PHGDH. This is positive. The gene mutation is positive, and it is an autosomal recessive disorder. So final diagnosis is Neolaxova syndrome and phosphoglycerate dehydrogenase deficiency. And if it's a purely Neolaxova syndrome, it is very fatal, and it could be even stillbirth. And we go for, though the gene report has mentioned the two things, but we go for phosphoglycerate dehydrogenase of the deficiency. Now, the the first of all, we have given when she came only Shamana Chikitsa that it was done in the first visit, the Bruhatvata Chintamani and brain cure. It is our own formula prepared at home. And that, see, don't worry about the proprietary names are there. And because in the practice we are forced to do because their combinations are better. But only the thing is, I will tell you the major ingredients whenever this comes. It is not for the publicity purpose. Please note it. And the brain cure, it contains mainly Vacha and Brahmi, and there are some other ingredients. Astibala is mainly this is Pravala Pishti and Mukta Pishti, like that. The Ayurvedic calcium ingredients it has, and Kshirabala Thailam for external application, and this Jandopa is a Kapikachu, is a purified Kapikachu powder has been given, and because she has a respiratory problem for this Shwasa medicine. This is a recipe. This is a yoga from Kashyap Samhita described in Pratishyaya Chikitsa Adhyaya. So now in the second time when she came, and then we have started giving this first Shodhana Chikitsa, and in Shodhana Chikitsa first Snehanam, that is Abhyangam with Kshirabala Tailam and Mahanarayana Tailam, and Swedana with Shashtika Shalipinda Swedam for 14 days, and Vasti with Tiktaka Kshira Vasti for 11 days. The Shodhana Chikitsa, after giving this Shodhana Chikitsa, accelerated the improvement compared to for last 6 months long Shamana Chikitsa. So, and the Shamana Chikitsa, we followed the almost the same drugs. So this you can see the before treatment, almost all the things were delayed, and after treatment, you see the neck holding improved. There was no seizures till the date, and rolling over, creeping, sitting, everything. The gross motor milestones she started acquiring, and she spoke the bisyllables. And now see, note her head circumference increased to 44 centimeters. It was 39 centimeters earlier. That means her brain is going normal against the norms of syndrome, which is a progressive disorder. Actually, the child should have been deteriorated, but the head circumference is increased here. So, and as I told you, then we have taken care of the allergic rhinitis, where the sneezing and cough also decreased, and drooling is ceased, and the normal soft skin and eye contact and active social smile. And you can see in the next slide, that is self-explanatory how best she is improved. So now at this this video has taken, she was 4 years. This is the last year video. This is one before. It is going to be. So she is the child now going to the 1 year back. This is going to Anganwadi school, and she's remembering and following the instructions, and also she's learning the so she is following the instruction of her mother, and because of the short time, I am moving to the next video. So see, her speech is also improved. So we cut short to this. So this is those two videos are about 1 year back, and this slide is very latest. Yesterday we contacted her parents, and she is going to school, and Only the thing is she is unable to speak still properly. Otherwise, all motor milestones and her cognition, everything is improved. And now she is 5 years old child. Next. So now you can see this is the very latest. She's playing the left side child is our case, and she is following the game norms, and she is carrying. So this itself shows the extraordinary movement according to the textual textual description. She shouldn't have gained all these gross motor milestones and cognition and speech. Rather she has to the regressed the case, and even survival was very the critical. But now she is 5 years and she is improving the year by year. So that is and that we move on to the next case. This is the next case is Fanconi anemia. This is also a rare genetic disorder, and this is a progressive deficiency of bone marrow cell production, and it is associated with some congenital physical abnormalities. Here also it's microcephaly and short stature, abnormal skin pigmentation, and progressive bone marrow failure, digital and skeletal abnormalities. And there may be structural and cardiac problems, underdeveloped GI system, and cafe light spots. These are some pigmented spots on the back, they like a moles, and there will be ophthalmology abnormalities like strabismus. So this is the next case that is Fanconi anemia. This is a case presentation. When the child came to us, he was a 12 years old boy, not gaining weight and height as his peer group. And this child is also born to consanguineous couple, full-term normal vaginal delivery. Birth weight was 1.7 kg. No birth asphyxia, but somehow he has low birth weight, kept in the NICU for 1 week, and normal up to the child gross motor milestones and development and cognition was normal up to 1 year, and at 1.5 years, a fever, child developed fever with chills and rigors, and in this case diagnosed as TB meningitis, and anti-tuberculosis treatment given for 1 year. And in 2013, the dengue, he suffered from dengue and had a treatment at pediatric government hospital Chennai, and there the blood report has shown as pancytopenia and poor appetite from last 8 months. Then the further investigations and the chromosomal and gene test done because of the pancytopenia and bleeding disorder, they have gone for gene test, and this gene test confirmed it as a Fanconi anemia. It is a autosomal recessive disorder because here also parents are consanguineous couple, and every fortnight the child was brought to the hospital for blood transfusion and platelet transfusion. And parents in such of, because this was a regular process, and then the parents were vexed up, and they wanted to alternate the system of medicine. Then they visited our hospital in the December 2014, where on examination child was found to be small face and eyes, and hyperpigmented spots over the face, and teeth yellowish and dysmorphous. These are all features of the Fanconi anemia syndrome, and diagnosis was already done because of the blood test, and when the child came to us, he came with the gene report, and where it was confirmed as Fanconi anemia. So the treatment according to the modern system, blood transfusion and growth factors to stimulate blood cell production, and androgen therapy to improve blood count, and stem cell therapy. Except stem cell therapy, the child has undergone, but there was no dissatisfactory improvement was there, and the child was taking blood transfusion until he came to our hospital. So according to Ayurvedic diagnosis, then we did it as a the Pandu Vyadi, and it is associated with mainly Pitta Pradhana dosha and Vata Kapha Bandha. So it is a chronic case, and so we started. He's already 12 years old child, so we started Shodhana Chikitsa, Abhingam with Bala Tailam, and for Snehana purpose and Vasti, we have given Laksha and Gudu Chikashaya Gulu with the uh, Laksha and Gudu Chikashayam and with the Gugulu Tikta Grutam as a Sneha part and total 200 ml. And Shamana Chikitsa internally we have given Brungaraja Asam 15 ml and TID and Punarnava Manduram and Aragyavardhini Trifala. These were the drugs we have given internally. And Patyam, the Eva Goduma, Mudga, etc., normal, the nutritious food, and we asked to avoid Pittavardhaka Ahara. So he was taken, he took treatment for about 1.5 years, and his general condition is improved, update was improved, and ever since he admitted in our hospital, throughout 1.5 years, he never need of the blood transfusion. And he once or twice he visited the modern hospital where earlier he was going for the transfusion, and they also suggested to please continue the same treatment as on today you are taking this Ayurvedic treatment. So treatment continued for 1.5 years, and till the date, that means if at all, because he was so dramatically improved his condition, so he could have gone, because he is very nearby, about 70 kilometers away from Tirupati. So any problem, if he could have developed, certainly he could have consulted us. That means for the last 10 years, he is absolutely normal. There is no complications. So this is another the successful case of gene abnormality. The next week we move to the next case. Next case is Jopert syndrome. See, Jopert syndrome is also a rare genetic disorder causing developmental delay, where brain develops with the underdeveloped cerebral vermis and brainstem. Here, the signs and symptoms are the child remains hypotonia. Because of the hypotonia, the all gross motor milestones are delayed, and intellectual and developmental delay, eye conditions, and breathing issues, and cleft lip and palate. There could be polydactyly and protruding tongue. The MRI brain. See here, there's no need of the gene test. This MRI brain, the molar tooth sign. See, it is visible. The molar teeth sign is visible in the. This is a molar tooth sign. See, this is the cerebellar peduncles with the brainstem cross section, and appears like a molar tooth sign. And this confirms Jopert syndrome. If it is there, then no need of the again going for gene test. This is the complete the textual picture described in the text. Next, and this is the case presentation. So this child is born to non-consanguineous couple, and they at 40 weeks of gestational age and vaginal delivery. Child didn't cry immediately after birth and due to birth asphyxia. So patient was admitted in NICU for 11 days, and the patient had seizure attacks and medication were given for seizures. Later, they took MRI and the report suggest hypoplasia of cerebellar vermis, and posterior fossa typically shows a bat wing fourth ventricle and prominent thickened elongated superior cerebellar peduncles, giving a characteristic molar tooth sign. So this is the report of the MRI of the brain. As there was no development in patient, they consulted allopathic hospital at Chennai, where she was diagnosed as Jopert syndrome. Pure Jopert syndrome. Child has been brought to our, and they said there is no treatment because it is a genetic disorder. The child has been brought to our hospital in March 2022, and where she has been given Vatahara, Brahmana, and Apasmarara Chikitsa. They visited third time in the month of June, and the child was improved. So USG abdomen, this is the report of the USG abdomen. There was some renal pyramids, the hyperechogenicity of renal pyramids were found, and provisional diagnosis and the final diagnosis, pure Joubert syndrome. And this is this Joubert syndrome can be correlated with the hypotonia, that is Mamsashithilata, and developmental delay. The features described in Ayurveda related to Bal Roga, Vataja, Nanatmaja Vikaras like Jadatva, Kampa, and Vata, Kampavata and Pakshagata. So the see, keeping these diseases in mind, our treatment protocol has been designed. See, Jadatva and Akshepaka and Bal. So the first we have given Shodhana treatment in this case, Abhyangam, say with Mahanarayana Tailam and Kshirabala Tailam, and Shalishishtika Pinda Swedam for 14 days and Vasti for 11 days. And Shamana Chikitsa, the brain cure, that is a brain cure because the directly or indirectly all these genetic disorders are related to the brain. So we have our first choice of drug is brain cure, and with Madhu and Sambardhana Grutam. So this is Sambardhana Grutam is described as having Brahmana effect, and Balamula Kwatam for about 15 ml twice daily, and Jandopa powder, because here also the midbrain and cerebellum are affected, and the Kapikachu, Shodhita Kapikachu, said to be very effective in midbrain disorders. So we have given this, the Kapikachu Churna and the Sarastarishtam for improvement of the overall the cognition and milestones and brain development. And this is the Darvaridra syrup, because she had some the Anubandha, the Atisara, for that we have given. So this is before treatment. All this you can see, you can go through. After treatment, she started neck holding and head control. When she came to us, these were absent, and rolling over and sitting with support, drooling ceased, and earlier she was keeping tongue outside, but very much control after this treatment. And now she is not feeling any difficulty in swallowing, and the anterior fontanella still small, and eye contact is very good and active in social smile, and responding very well to the Ayurvedic treatment, bisyllables, and reaching for an object with hand. This is the progress about the 3 years back. Right now I can show you the sitting, because lack of time. Just I will show you a picture of the just a few months back. She's the case. Actually, she was keeping all the time the mouth open, and see that the upper lip is dropping because of this severe hypotonia. Now she is able to stand a little support by the father. You can see she is able to stand only the back side, a bit support. So this is also the very good improvement in Joubert syndrome with our treatment. Now the present going cases are, as on today, they are under our treatment. This is a bilateral grade 5th vesicular ureteric reflex. That means the urine was getting reflex towards the kidneys from the bladder. So this is a condition which refers to dilatation of the renal collecting system due to buildup of urine resulting from the drainage problems, commonly triggered by transient development and uretropelvic junction obstruction, or this is vesiculourethral reflex. It is frequently detected via routine prenatal ultrasound. The clinical features. This is the case. No? So the clinical feature, pain in flank region and abdomen and renal area, and fever, and child used to have frequent urinary infections and dysuria, weak urinary stream, renal scarring, and nausea and vomiting. now the so far I explained about the textual description. Now case study. So now the child now the child is 8 years old. Now the child, when he came to us, the child 8 years old, the complaint was recurrent urinary infection and proteinuria since 3 years. The child felt sick always, reduced appetite and constipation and difficulty in passing urine. Though, so in the history of present illness, first the child of a non-consanguineous couple and the normal vaginal delivery, the forceps delivery, sorry, and the child cried soon after birth, and the birth weight was 3.2 kg. While routine USG, mother's gynecologist informed her that the child is having swelling in the right kidney. Actually, this is the report given by the mother that during the intrauterine life in the third trimester, the child, the fetus had the hydronephrosis. Hydronephrosis. That means the child had born with a congenital anomaly of the urinary system. Here, because it is already some 80 years back, so the report is not found. So you have to believe, because this is the history given by the by the mother, and she tried even today, but she didn't get that intrauterine life USG. So at the age of 5 years, child to know the blood group, they went through blood test and done a routine urine test, because he's having a burning micturition. Child was having burn micturition, and on the test they found proteinuria. This proteinuria is the reason why the parents began to notice the child was having recurrent sickness, fever, and constipation. Then they went to a urologist, and on USG, they found the grade 5th reflex and vesico urethral reflex, that is VUR, for which the doctor suggested urethral reimplantation, and further investigation. Then on consulting a pediatrician, they came to know that he is having heavy poop in the cecum, and they scan, DMSA scan done there. This is a nuclear image. There were both kidneys carrying. So they went for surgery in August 2023. For 6 months after the surgery, it was uneventful. The surgery was the reimplantation of the bilateral ureters. In 2024 April, he got again urinary tract infection. So they again went for MCU and DMCA, in which there was same situation as before. That means as before the surgery, the same again it was found. So was suggested to do surgery again. So they were ready for another surgery. But before the surgery, the doctor said there is a reflex in right side and maybe in left side also. So as the doctor was unsure about it, they went for Ayurvedic treatment where Vasti and Abhyangam was done. The reflex decreased dramatically, and ultrasonogram of KUB was done. After treatment, the swelling reduced. So then he used to get urinary tract infection less frequently. In 2025 November, he got constipated, and on USG, KUB, again swelling and cystitis in bladder was seen. So, and in January 2026, he got severe urinary tract infection and was consulted to a urologist and suggested the surgery. But the surgery didn't take place because on cystoscopy, there was a trabeculation in the bladder, and wall thickness was increased by 6 mm. So he was not fit for surgery. So now they are here for the management of the same. So the urologists were not sure what type of this case, and because the wall thickness is very large, 6 mm, and trabeculae were present, and the reflex is very high, and so first they wanted to give palliative treatment. Now, this is immunization shield, and when the child came to us, the child was under stress, dark cells under the eyes, dark circles under the eyes, and nipples were a bit swollen. So, in systemic examination, except this, the nasal septal deviation was present and the nasal polyps were present. They accept the urinary system, painful micturition sometimes, and he had constipation. So in personal history, the bowels sometimes constipated, and sometimes appetite is reduced, micturition reduced, and the sleep was normal. And because of respiratory problems, sometimes he used to sleep the mouth open. He was taking the breathing from mouth, and there were adenitis, and he's this mixed diet. So the birth history is is 8th month USG showed the swelling on the right kidney. This is and the surgical history, they have done bilateral ureteric reimplantation under general anesthesia on 26th. This is 2023. Sorry, this is the date. It is 20. This surgery was done on 2023. Here, please, it is wrongly typed. And the developmental history, all developmental milestones are achieved. Now the child is going to school. These are anthropometric measurements. So this is the investigations. At the age of 5 years, you can see here a proteinuria is seen here. The proteinuria is present, and that was the reason why the child, after all investigations, finally they diagnosed as bilateral grade 5th vesiculo-ureteric reflex and bilateral hydronephrosis, for which the reimplantation of bilateral ureters done in 2023, but there was no only for 6 months or 1 year child was free from the symptoms, but later on the same clinical picture is developed at that time. Again, when they suggested for surgery, the patient came to us. So now the treatment, final diagnosis, this is the bilateral grade 5th vesicular-ureteric reflex. So Ayurvedic treatment. So first what we have done, when the child came to us and we admitted Abhyanga with Balataila for 14 days and Pindasweda for 2 days and Katvasti with Balatailam for 12 days and Vasti for 11 days. And the Chikitsa is Aragyavardhini 1 TAD for overall development and Rinalin. So because they don't say Rinalin 4-leaf and Gokshara the Gugulu. All these have main ingredients are Punanava and the Gokshura and Varuna, etc., which are and Manish Shilajitu, etc. For leaf, the 4-leaf, this is like Aragyavardhini, the same some ingredients and Bhumyamalaki and liver stimulant drugs are there. So now Vukashota Kashaya, that is we prepare. This also has having the apart from this Punanava, Gokshura, etc. Then it has some other ingredients like Tulasi and Ashwagandha. And we have also to support, this is not a modern drug, but to support the general health, Neurobion Forte, we have given one word, it is B1, B6, B12, and he is having a severe, the recurrent upper respiratory problems, the allergy. Again, this child is also given the half-spoon Shwasa medicine, that is Shwasa Yoga, the half-spoon with the warm water, TAD, and this churn also the for respiratory infection. So this is before treatment, and now you know they when came the diagnosis, you know, after first sitting, the renal pelvic the anteroposterior diameter, see right is 28 mm previdal, and this postvidal 18 mm, and here left one 20 mm and 10 mm. This is of kidney size, and the urinary bladder thickness 1.7 mm. after the 14 days treatment, it was earlier, it was the 6 mm, 6 mm thickness, and now it is 1.7. The not almost, it is a normal wall thickness. And the on USG, the only bilateral moderate hydronephrosis, that also in the report he put a question mark. He is not sure. He is almost thinks, because earlier reports are saying hydronephrosis, then he put a question mark and he put, so it was also almost normal. Ureters were normal. There was no the proteinuria, and the creatinine is normal, the everything is normal, and all modern drugs were withdrawn. So then after another 3 weeks, again we asked to come our actually modern drugs. At the time of first sittings, we asked the child to taper off all those drugs, and by the second sitting, no modern drug was there. And now the renal pelvic calcium AP diameter, it is right 16 mm, and the postvidal 9 mm, and left 14 mm, and this one 7 mm. It is a 7 mm or 7 centimeters. Bladder thickness was 2 mm. So this is also normal, and with a few trabeculation. So that is the reason why so see here he has put the question mark bilateral mild ureteronephrosis. The improvement in the micturition normal, no dysuria, no constipation, and urinary tract infection decreased, and no fever episodes so far. So this is the last case. We are this is a known case of a gene disorder. Here it is known as intellectual developmental disorder. Here the abnormal gene is known as DYRK1A syndrome. This syndrome is characterized by intellectual disability and impaired speech development, and it will have ASD, including anxious and stereotype behavior and macrocephalus. These are signs and symptoms. The feeding problems, gait disturbances, foot anomalies, and intellectual disability, seizures, and hypertonia. Hypertonia, I think. Here, after the this gene test, the patient actually, this is a treatment given online. Because the child's mother is a professor in Ayurvedic college in Panchakarma department. So that is the reason why the coming all the way from North Pole to South Tirupati. Then I guided her the entire treatment, and she followed. So first I'll present the case. So 8 months old male child, head drops and noticed by mother since last 20 days. This is the history taken some 2 months back. No responding to sound. History of present illness: firstborn child to non-consanguineous couple, and LSCS. The 2.4 kg birth weight, and the birth weight is a bit delayed, and the child is having some congenital anomalies like single umbilical artery, and was kept in NICU for 3 days. And the child has atrial septal defect and patent ductus arteriosus at birth, and closed at 3 months of age, and double superior vena cava and ventral septal defect. All these were almost now have become normal. The mother noticed frequent head drops since last 20 days. Global developmental delay with microcephalus. At the time of birth, the head circumference was 32 centimeters. February 5th, 2026, 32 centimeters there at the time, and bitemporal narrowing fused metopic suture, and prominent tears, and under eye puffiness, high nasal root, and small mouth, small hands and feet, hyperpigmented macules. The umbilical hernia was present. So these are investigations. Investigations almost remain normal, and the thyroid profile and EEG normal, and the BERA test was normal. MRI brain has shown the corpus callosum thinning, and the splenium dropping, and mild neuroparenchymal volume loss is noted, and in the supratentorial region. So that is the reason why microcephalus is present. Now, this is a 2D echo report, and USG abdomen, umbilical hernia, and this gene test. See, it is the gene test, DYRK1A, gene mutation and intellectual development disorder, autosomal dominant 7. This gene is present in chromosome 21 chromosome. So this is original the gene report, a gene test report, and you can see the DYRK1A is a positive in this child. Now the child is under our treatment for the last 2 months. I hope so. Then the Shamana Chikitsa, initially we start Shamana Chikitsa, this brain cure, the 1 tablet BID, and along with the Brohatvata Chintamani, and this vitamin D and calcium syrup twice daily. All these drugs are given along with the Kalyana Bruta, and the Saraswatarishta and Swadishta Virechana Churnam. So these are the drugs kept. The child is, mother is suggested to give the following Shodhana Chikitsa. Abhyanga with the Shastika Shalipenda Sweda and Vasti for 14 days. So now after the one sitting of the Shodhana Chikitsa and the Shamana Chikitsa that we say started after 2 months or more 2.5 months. This is the video. Play the video. This is the video of the child. Now he is able to see with support. He is able to stand. And you see the his head size also is increased. The next slide. So now the child is now 14 months old. Now these on crawling. So this is also a delayed, but this development is only after our Shodhana and Shamana Chikitsa. So the first case, Leon-Axelrod syndrome. It can, because it is the enzyme deficiency, and that leading to the serine, the metabolism abnormality. So this is in other terms it is known as inborn error of metabolism, and this case is interpreted according to Ayurvedic principle as an impairment of the Dhatu Agni, which causes non-formation of Uttarottara Dhatu, and this plays a primary role in the present case to develop entire clinical picture. Therefore, treatment protocol for genetic disorders they be designed. So Dhatu Agni improvement, for Dhatu Agni improvement, where Dhatu Agni improvement, Arugavardhana and this improving the liver function, and the directly or indirectly brain is affected. So brain cure always is a prime drug in these cases. And Apashmara Chikitsa, recurrent seizures, the child already kept the levetiracetam. First child also, Leon-Axelrod syndrome also, they kept the levetiracetam, but only after 1 month they stopped. Now the child is not taking any levetiracetam, but this child, the last child also is given in small doses, and the small dose is being continued. And Pradhan dosha, the Vata dosha, that is the reason why Brohatvata Chintamani is suggested, and many Ayurvedic people, and especially even Kaumara Pradibhutya experts are also, they hesitate to put this Rasaushada. But this is, I am sure, the 100%, there won't be any side effect, there won't be any renal toxic complications. It is very effective. In some cases, I have given Brotva Chintamani Rasa. Even the days old child, probably you don't believe, even 3 weeks child was given Brotva Chintamani. So here also we have kept the child was only about 1 year old, then Brotva, and this also the Conch Bees Churna is kept, and this is other drugs are only supporting for Anubandha Vyadhi. For Jofert syndrome also, this the same treatment I explained. The now time is up, and the same it will be repetition. So already I shown the treatment of hydronephrosis, this congenital hydronephrosis. All these drugs already explained. So what I mean to say, after all, genetic disorders, gene mutations, the first time in some individual take place, and then parents do suffer from, and not all the times parents are carriers, but sometimes it new. So these mutations in the genes takes place because of the environmental changes, environmental effect, and behavioral and lifestyle. All this together over a long exposure makes the abnormalities in the genes. So with the same idea, we dare to give, even though they are very serious and rare genetic disorders, with the same idea, why can't we regress? Why can't we take the back? This abnormal gene cannot be made rectified by giving the same changing environmental, that is drug and patya and lifestyle disorders. With the time and the proper the symptomatic treatment based on dosha sammochana. And this is the basic principles we followed in all these 5 cases, and it has yielded very dramatic improvement in these cases. So evidence is significant, and the diagnosis is significant by the gene test reports, and the improvement by we presented the clinical examination improvement and videos. So this in further also the nobody no one should hesitate to undertake this genetic disorders with the Ayurvedic treatment. Only the thing is we must have, for better Ayurvedic treatment, based on, we must have some basic knowledge of genetics, so that what is the exact pathogenesis is taking place because of the gene mutation, and we can translate this, the specific dosha sammochana according to Ayurveda, so that we can choose specific Shodhana Chikitsa and Shamana Chikitsa. So thank you very much. And before conclusion of this, and my current batch students, Selina and Varna and Alfie, these all 3 students, especially Selina, and Varna. Varna is presenting this special case. What is that? Hydrouretro. This so they have helped. Otherwise, because it in short notice, I couldn't have presented this so many slides. And thank you very much. Now what is that?
Thank you so much, sir. Now, if anyone having any doubts, you may please ask to sir.
Hello. Hello, good evening, sir. Am I audible?
Krishnaiah ji, very, very good presentation.
Thank you, sir. Namaskar. तो बहुत बहुत धन्यवाद है सर।
बहुत दिन बाद आपके दर्शन हुए इसके माध्यम से।
सर केसेस ज्यादा है, टाइम कम है, इसलिए आप थोड़ा
बहुत अच्छा
फास्ट में प्रेजेंट किया है।
चलिए, नहीं बहुत अच्छा है। नागेंद्र जी को नमस्कार, नागेंद्र पाल जी को नमस्कार।
Do we have any questions?
Krishna, it was a good presentation.
Very nice and good presentation.
Now we are going to conclude the session. Thank you so much, sir. On behalf of the organizing committee. Am I audible, sir?
Hello.
Yes, sir. On behalf of the organizing committee, I would like to thank Dr.N. Krishnaiah, sir, for delivering such an insightful lecture. I would like to extend my sincere gratitude to our mentor, Vaidyadevan Trigunaji, President of GV for his continuous support, guidance, and blessings. I thank our director, Dr. Vandana Siroha ma'am, who is the guiding force for all the events at RAV. I would also like to thank Vaidya Rajesh Koteja, sir, Secretary, Ministry of Ayush, for his participation and encouragement in all our endeavors. Most importantly, I would like to express our heartfelt thanks to all the gurus, shishyas, and other scholars for their presence and active participation for making this webinar a successful one. Thank you so much, sir.
Hello. Excuse me.
Thank you. Thank you so much.
Question.
Question? Yes.
Yes,
It's a question.
I think
Yes,
we have
please.
some questions, sir.
Yes.
Sir, am I audible to you, sir?
Hello. Sir, the case you discussed with us and the sir बस्ती जो आपने बताई, सर वो
हाँ,
कौन सी बस्ती आपने प्रेफर की और उनका डोज कितना रहा अकॉर्डिंग टू कंडीशंस एंड एज, उस पे भी थोड़ा प्रकाश डालते हैं.
yeah, because, yeah. So I couldn't explain in detail of Vasti. In the first case, neolaxova syndrome, that is Kshiravasti, that is Panchatikta Kshiravasti. That I came to know on the earlier we were giving our own, and this is we wanted to try on this syndrome, neolaxova syndrome. This Kshiravasti, Panchatikta Kshiravasti is presented by Upendra Dikshit ji, our RAV Guru. So then I wanted to try this, and that was the Panchatikta Kshiravasti is obvious, and a number of times recently also one of our Guru presented this Tikta Kshiravasti, and that is what in other cases. See what we do based on the dosha samochana and the doshas, the only kashaya part of the vasti, we change. For example, in this urinary tract syndrome, the abnormality, there we have taken the Punanava, Gokshira, and Varna. These are the drugs. Mainly, these are the drugs with which Kashaya is prepared, and rest of the drugs are the same. The Taila part we have taken the Mahanarayana Taila, and the rest of the routine Nirovasti ingredients, the Prakshepa Dravyas and Shatapushpa and all that. So there is based on the presentation of the case. That is we have gained, and the rest of the things are neurological disorders. For all the neurological disorders, we follow the Kashayam. They made up of Brahmi, Vacha, and the Eshtimadu, and sometimes we add Ashwagandha, and depending if it is a behavioral disorders, then we add Jatamamsi, like that. So these are the ingredients we use in Vasti. So this is, and Vasti we follow strictly the according to the quantity, everything we follow the description mentioned in the Kashyap Samhita. So it almost it is depending upon the age, not only in these cases, depending upon the case, the total quantity of the Vastadravya is 40 ml to 75 ml. If the child is older, then we go for even 100 ml. Like that. This is the Vasti, the formula that we formulate and we give.
Sir, and my second question is that in case of cerebral palsy and autism or hyperactivity disorder, what is your line of treatment and how to deal with that type of cases?
See, now cerebral palsy, we have been doing this Shodhana Chikitsa and Shamana Chikitsa for the last 25 years in our hospital, and we are following whatever the formula, for example, for cerebral palsy, in cerebral palsy, Shodhana Chikitsa is Abhyangam with Kshirabala and Mahanarayana Taila combination. And if suppose the rigidity is very much high, then we use Prasarani Tailam for Abhyangam. And then Shalishashtika Pinda Sweda we do for 14 days, and I need not explain about Shalishashtika Pinda Sweda. And Vasti, when it comes to Vasti, the same drugs, the Vasti we use in case of cerebral palsy, this Brahmi, Vacha, and Jatamamsi, and Ashwagandha, and Eshtimadu. These are the common drugs that we use. When the cerebral palsy is associated with the other features, then we also take those conditions into consideration and we add to the Kashaya. So in the Vasti, the Kashaya preparation, we change according to the need or Anubandha Vyadi. So that is, and this we have been following for the last, and that is the reason why it's a name is CP formula. It is even now after my leaving of my institution, even then the now present doctors and postgraduate scholars are following the same CP formula. And Shamana Chikitsa, that is a bit different. The brain cure is actually brain cure is has a very long history. It takes time, and its the main ingredients are Vacha, Brahmi, and then Jatamamsi, and we make these ingredients with bhavana with the various drugs like Kushmanda and Gomutra, Lashana, etc. Then we make bhavana, and this takes about a week to 10 days to prepare this. And this history, why I have been following the same formula, that will take time. If any time the concerns, then how this has been this. So this formula is not textual. Of course, basics are based on our Ayurvedic text only, but this formula of brain cure, I tried on a single case. It was a post encephalitis sequelae case where the child was became blind, total blind, and the other entire other functions have been recovered, but the blindness was not cured, and MRI brain shows the atrophy of calcarine area, that is visual cortex. So the many people didn't believe after treatment of 1.5 year, the even reports were sent to USA, and they also said better to join in blind school. But after giving this formula, and all the drugs are not remembered, but whatever I remember, I made into the brain cure. And after 1.5 year treatment of the child, 100% child has regained vision. That means this indicates our drugs they definitely regenerate the neurons. It may be the exaggeration, it may appear exaggeration, but recently so many research reports say that the brain tissue can be regenerated. In the last when the international conference held at the Ahmedabad, there one research scholar from Delhi University, he presented with Brahmi on animal experimentation, and he has shown the very good regeneration of the nervous cell, the neurons. So I was knowing this is the case. This post the encephalitis equulecas, I'm talking about 32 years back. So this brain cure is formulated some 32 years back. So from then onwards, the same drug. So that is the reason why it is kept. Its name is brain cure.
Thank you, sir.
You're welcome.
Do we have any other questions? Thank you so much, sir, for delivering such an insightful lecture. Thank you all.
Sir, what should be the treatment for autism? If there are any treatment for autism?
Autism.
Autism, yes.
Autism.
If there are any study?
Many Ayurvedic experts are giving now we get, because autism incidences are more than cerebral palsy. Cerebral palsy incidence is 2 in 2. Nowadays it is increasing in 2.5. The 2.5 per 1,000 cases, but autism cases are 68. The 1 in 68 per children is autism. So now our treatment, and we are more engaged in ASD treatment. Here we do Dhara Chikitsa. Then before that, then we do Snehanam and the Dhara, Thakradhara, and next we give Vasti, that BD formula, and then we also nowadays giving Nasya Karma. This is all we are following, and the relatively the all other existing treatment, that means only for autism only therapies they suggest, and when compared to that our treatment is far better. And there are I should not claim again, but there are cases in of autism they 100% recovered. I should not say as per the laws and text and moral this one, but now the children after taking our treatment, now they are studying in 8th class, 9th class, 10th class, and with various extra talents like playing music and all that, at least, but not many cases, but a good number of cases. At least 5 to 10% cases are excellent improvement after our therapy, and some are other treatment. In 80% of the cases we get improvement, and the better improvement, recovering speech and all that in 50%, almost 40 to 50% of the cases are there. So every day we are giving minimum the 4 to 5 cases of autism. This Panchakarma therapy we are following.
Thank you, sir. Thank you very much. And thanks for your nice presentation. And
Thank you.
this
Thank
type
you so
of
much.
enlightening lecture. Thank you, sir.
Namaste, sir.
Thank you so much.
Namaste, sir.
Namaste.
Can you give me the treatment principles for bedwetting, which is more common among the children and even in teenagers? Bedwetting.
Bedwetting.
Yes, sir.
Madam, my 10 to 5. Okay, bedwetting, madam, the whatever in Komarabhritya description is there, that is Bimbi, Mulakwat, Churnam and all that. In my experience, not much encouraging results were found. Now I tried one recipe mentioned in Bhav Prakasha in the management of Mutratisara. In the management of Mutratisara, this recipe is the Vatachurna made up of Murva and Balamula and Twak. Murva, Balamula, Twak. One more drug. Okay, do teen. This we make the Vatachurnam, and this is comparatively very effective, madam. Within 3 to 4 months, 5 months, the 80% of the children become dry from the Shaya Mutra.
The dose, can you tell me the dose?
Dosage of this Kashaya. In the Shaya Mutram. Madam, you are asking about this Shaya Mutra Chikitsa?
Yes, sir.
So dosage again depends upon the age of the child. If it is suppose if the child is about 2 to sorry, not before 4 years, it is not called Shaya Mutra. If it is 5 years, you can we suggest 15 ml twice or thrice daily. If the child is old enough, about 10 years or like that, you can go on. It is a kashaya, you can give 20 to 30 ml BID or TID.
Okay, sir. Thank you. Thank you, sir.
Thank you so much, sir. Now we conclude the session.